Shall we start, sir?
One second, just a second.
Okay, sir.
Here is this. Once again, Sandeep, there is something should come here. It's not coming. Once again. Here it is. Oh, just a second. I don't know. There used to be one option where I can see the slides here. I think almost done. One second, just a second. Share is here. For the next slide, I don't know how to go for the next slide. Yeah, that's fine.
Shall we start, sir?
Sandeep, 1 minute. I'll just push this up. And now we can. Yes, we can start.
You can start, sir.
Good evening again, doctors. Welcome to our next topic, Virology 4. So you know that we are in our 90 days university prof pre-final mastery classes. So today is our Virology topic 4. You know what we are going to do. We are going to have a rapid revision of all important questions. Volatile fact, quick revision will be there. High topics we are going to discuss, and most expected frequently asked questions will be discussed. It's not only for university prof exam, also for next exam, NEET PG, and for FMG students. For everything, it's going to be very, very useful, right? This is what we are going to do now. So the next, we are going to talk one by one now. One second, just a second. Yes. So now what are the topics we are going to discuss here? So we are going to have today, we have long essay as usual. We have a long essay and the short essays. So in long essay, we are going to, the first question would be for you to classify the viruses, classify the herpes virus infections. Okay. So basically herpes one question is sure. Okay. One question will come from herpes. So it's about herpes viral infection. And the other one is classify the myxovirus. Myxovirus is basically the orthomyxo and paramyxo. Another very important question because influenza will come under orthomyxo. So these two are the two long questions. And short questions, we are going to discuss about varicose zoster. You know, herpes zoster is important, lifelong, until you either you become a dermatologist or become a internal medicine specialist or pediatrician. Varicose zoster will follow you lifelong. Okay, so that is a must topic. Science may related to that, and MMR vaccine, you know, it's very important. You will study in PSM also. We're going to discuss here, and then again, influenza and viruses differences. Okay, these are the things we're going to talk. Okay, now. So why you choose Auricle? You know that why you have to choose Auricle. You choose Auricle because you know we have all the recorded classes we have a live classes which you're doing now, practical sessions, exam module, and hard copy book sets. Okay, these are the few reasons why you have to choose Auricle. Right. Now next one. Here recorded classes. The recorded classes benefit is for flexible. You're going to have a very good flexible learning will be there. Okay, you'll have a one second. So you're going to have a flexible learning, flexible. Yeah. So basically, when you're going for when you talk about the recorded classes, the benefit of these classes are flexible learning, depth, you know, expert instructions will be given, convenient revision. Whenever you want, you can just simply open and learn it. Those are the benefits of this one. Okay. That's going to be very, very helpful for you. And then next. When we talk about the next one is, sorry. Yeah. Yes. So live class, when we talk about live classes, you know that in live classes, we are going to have in-depth coverage, okay? And then experienced educators are here to help you out and interactive learning will be there, right? Yes, then next. Okay, then of course we'll talk about this one. When you talk about the express, express exam module, you're going to have all the complete syllabus in 20 hours. We're going to study, and also answer writing skills and expert educators are other benefit when you're going to have for this express exam module. Okay, fine. Next. Okay, one-to-one doubt clearing session is also going to be very, very benefit for you. It's very new. It's only in Oracle you have this one. Okay, so you're going to have a student-based approach. There will be a good student-centric approach. There will also be personalized attention and safe learning environment will be there. This is one-to-one doubt clearing session. Okay, this one. And then next will be your, yes. Now, of course, you're going to have a hard copy note set also, which is very, very, in-depth coverage. Same thing, you're going to have interactive learning and everything. It's very benefit with that. Question bank also, we have very good 3 levels of expertise consecuted, beginners to expert level questions, customized question bank also. And then, of course, custom question bank and covers all the MCQs of Proff exam, NEET, PG, and FMG also. That's another benefit you can say. Okay. Yeah. And the practical session also, you will have a hand-on experience, expert guidelines, and excel in the practical examinations. And then these are the plans you can see. We have foundation plan, advanced learning plan, complete learning plan, also ultimate MBBS plan. Accordingly, you can choose whatever you like and then use this code. You can use this code Dr. Santhosh Rajan 20 for discount on the subscription. Okay, so now let's start a topic. Okay, now let's start a topic here. First of all, yeah. So the first question is this. Second, yeah, you can see it's to classify the herpes virus, human herpes virus infection. Okay, basically they're asking classification of human herpes virus infection. And then, of course, mention the general characteristic features, add a brief note on herpes simplex virus, morphology, pathogenesis, lab diagnosis, and antiviral agents are asked. Okay, now, first of all, classification of the human herpes virus classification. So, how you classify? When you talk about HSV classification, it's very simple. You only have to write their names. That's it. So we have almost 8 types. Okay, important one. HHV1, HHV2, HHV3, human herpes virus 1, 2, 3, 4, 5, 6, 7, and 8. So these are the things we have. Okay, totally we have 8 types. So in this, what are the things you should know? All the names of the viruses. That's the very, very important one here. When you talk about 1, it is basically herpes simplex virus 1. Okay, herpes simplex virus 1 for 1 easy. 2 is basically herpes simplex virus 2. 3 is basically varicella zoster virus. Varicella zoster virus, we call it as the 3. 4 is basically Epstein-Barr virus. Okay, Epstein-Barr virus, EBV we call. If you forgot, also remember BARR bar. Just 4 words, no? Epstein 1, 2, 3, 4, 4. Here also for zoster, if you forgot, these are 3 strokes, no? 3 strokes. So it is 3. Okay. Bar is equal to 4. 5 basically you write like this, no? So this inverted C. So it is CMV virus, CMV. 6 and 7, they cause a disease called Roseola infantum. Roseola infantum. Okay, Roseola infantum. S is there. So this is 6 and 7. Okay, this is 6 and 7. So you can remember like that, Roseola infantum. 8 causes Kaposi sarcoma. Kaposi sarcoma. Kaposi sarcoma virus, causing virus. Okay. So sarcoma K is like this, right? So you can make like this. K, if you put like this, it becomes 8. So 8, H is 8. Okay. So this is the classification. It's a basic classification. Okay. Now, what is the next question? The next question they have asked is herpes simplex virus, morphology, pathogen, clinical feature and all. Okay. So before that, there is a general characteristic. Okay. When you talk about general characteristics of herpes virus, what are the general characteristics of herpes viruses. You know that all the herpes viruses, they are DNA viruses. You know, all are double standard DNA viruses. Right? That's first point. Okay, they are all are double standard DNA viruses. Second one is that they are spherical in shape. If you see all the herpes virus, very simple. They just have an envelope, right? They have an envelope. If you want to write it shortly, envelope with glycoprotein. They have envelope with the glycoprotein like this. Envelope with glycoprotein, and the spikes are called basically glycoprotein for attachment. Yeah, for attachment. And then what else they have? They have this inside there will be a capsid, right? There will be a nucleocapsid. This is a nucleocapsid. Nucleocapsid. And inside nucleocapsid, you will be having this DNA, right? You will be having this. It's sort of linear. So I'm going to write it just DNA. Your double standard DNA because it comes in happy group. So H for herpes. Okay. So DNA. This is the structure, simple structure. So they are spherical and of course they have spherical and they have icosahedral symmetry. Icosahedral symmetry. All the herpes are same. They have an envelope, glycoprotein, nucleocapsid. You can draw the picture. This is structure. Most important thing here is the most important feature is that all herpes virus, they remain latent. They remain latent in the host. Okay. It means once they are there in a body, they remain in the host forever and they cause reactivation when immunity or any other condition. Usually the reactivation happens in any immunocompromised state. Not necessarily immunocompromised, even when body temperature fluctuates anywhere. Okay. Usually it is immunocompromised state, it gets reactivated. Like your chickenpox example. Okay. So this is the basic general characteristic of this herpes virus. That's all. Okay. So basic is they remain latent. Example, if you see HSV virus, they live in the neurons, right? New HSV or new varicose zoster virus, they remain inside the neuron. And whenever the condition becomes your immunity or whatever goes down, then it gets reactivated. That's what it is there. Okay. Fine. Next. Next one is yeah. So we are done with this. Now, about the herpes simplex virus. When you talk about herpes simplex virus, very, very simple. You only going to talk about herpes simplex virus like this HSV1. It's better we write it HSV1 and HSV2. Two types of, we have herpes simplex virus, two types, no? Herpes simplex virus 1 and 2. Now, what are the important points we should know? Herpes simplex viruses, usually they cause vesicular lesion, or both causes vesicular lesion only. I'll show you the pictures. Vesicular lesion above waist. Above the waist region, all are caused by HSV1. This is below waist. HSV2 is below waist. Same, vesicle, okay, below waist. Both are causing pain. It's here, of course, both the cases painful. Both the cases, it's a painful vesicle, but in herpes 2, it's more, okay, more. So now we're going to talk what are the diseases it causes. Vesicular lesion, okay, fine. Now, what are the diseases? When it is happening in the mouth, we call it as herpes labialis. You can see many people, okay, herpes labialis. It means it happens in the lip region. In the lip region, you can see many people after fever there. That is called herpes labialis. Okay, herpes labialis. Then you can have herpetic whitlow. Herpetic whitlow. When you talk herpetic whitlow, it is in the finger. When you have this HSV1 infection in the finger. Okay. Then we have herpes gladiatorum. Gladiatorum. This usually people have it on the face and in the chest. This usually happens in the wrestlers. Okay, these are the common characteristic features. And one more thing, this HSV1, usually it remains in which ganglion? Trigeminal ganglion. It remains in the trigeminal ganglion. Remember that, trigeminal ganglion. Next point. Okay, and complication. When we talk about the complication, it causes a very important complication if you remember, especially in children. It causes anywhere it can cause, but here usually it causes temporal lobe encephalitis. Temporal lobe, and frequently asked one more question also. Temporal lobe encephalitis. Temporal lobe encephalitis you call. Okay. Temporal lobe encephalitis very, very characteristic, commonly caused by the herpes simplex virus only. Okay. Fine. This is usually caused by this. Now, below waist. No, in HSV2, when you talk about HSV2, you should know that this is causes which is a STD. So it causes genital ulcer, painful genital ulcer, which is painful. I told them one of the most painful ulcer when you talk about this is this only. Okay, it's STD. So HSV2 causes genital ulcer. You know that one. Okay, it's very painful. Fine. The vesicles will be very painful. Okay, and then as a complication here as a complication, when it goes in children, when mother is carrying and if child is born or any case, immunocompromised state or whatever, they can cause what? Mollaret's meningitis. Mollaret's meningitis. This is basically type of recurrent meningitis. We call it as recurrent meningitis. That's it. Okay. So this is a complication of a herpes simplex virus 2, 1 and 2. So now, because here it is trigeminal ganglion, here it remains in the sacral ganglion. Sacral ganglion. So now, if you think, sir, it's difficult how to remember this many things. Everything starts with S. Second, no? So SECOND, second. So you have second, you have STD, and then you have sacral ganglion. So everything comes with SSS. So it's easy that you will not remember. Okay. So this much. And these are the clinical features we spoke. Okay. Now the morphology is same. We already told that. We told that this is typical spherical shape with the envelope and the nucleocapsid DNA. Okay. Not going to talk much. So these are the pathogens and clinical feature. Now next is your next part will be your laboratory diagnosis. Okay. Now laboratory diagnosis common for both. Lab diagnosis of both HSV 1 and 2 will be almost same only. Okay, they're same. So what you do? The first thing is this, which you're going to do is a Sang smear. We'll talk about, we have a separate question for Sang smear. When you do a Sang smear, you will find what? A multinucleated giant cell, MNGC cell we call. Okay, multinucleated giant cell. Multinucleated giant cell. When you do a Sang smear and stain with Giemsa or Leishman, any stain you do, you'll see a multinuclear giant cell. Okay, you can see from the vesicular rash. Okay. Second, apart from this, what else we can do? We can also check in the smear, when you take the Sang smear or when you stain, you can check for which body. If you remember, we talked about Cowdery A inclusion bodies. Inclusion bodies. We have A for Hay BAP. Remember Cowdery we said. So in Hay BAP, HAY, we told that when it is inclusion A, herpes, yellow fever. Hay BAP. BAP is when B is for adenovirus and the poliovirus. That is different one. Okay. So this is for Cowdery inclusion bodies you see in this smear. But apart from that, what are other important tests we have? Of course, we can do cell culture, right? We can do cell culture. Cell line culture you can do for all. This is common for all the viruses. Okay, cell line culture, though it's not a microscopy of gram stain or anything. This is just it's more of like a biopsy only. Okay, because you're taking a smear from the tissue and then you're making this thing as you're going to look for the cell, not the bacteria itself. You're looking for the cells only. Okay, so Sang smear, Cowdery body, cell line culture you can do, and of course the most important thing is your PCR. PCR is very specific. It can differentiate. It can differentiate both HSV 1 and 2. Rest all you can't differentiate HN 1 or 2. Only PCR will differentiate HSV 1 or 2. And of course, the other one is your ELISA, which is commonly done. Excuse. So these are the diagnostic part. Okay. Now antiviral agent. Antiviral agent, you must be thorough and frequently asked question again. Antiviral is usually the treatment. The treatment is which antiviral drug you give for any herpes. Of course, the standard treatment, that is your acyclovir. If people are allergic or if it is resistant, then you go for foscarnat. Foscarnat. That's it. This much. Acyclovir and foscarnat. This much about your herpes virus. Okay. Very, very simple and easy. I hope you will not make any mistake in this question. Okay. Now, next one. Next slide. So everything is there. You can see when you okay, everything is explained. Classification, herpes with general vision. The picture also mentioned here, and then herpes simplex virus 1 and 2, where they remind you everything is written. You can see Okay, everything is mentioned. So these are cell line culture, treatment, everything is mentioned. Okay, fine. Now, yes, next one. Next question is, one second. Yes. Now this one. Now our question is myxovirus. Classify the myxoviruses, okay, myxoviruses, and also write the morphology, antigenic structure, variation, lab diagnosis, pathogenesis, prophylaxis of influenza virus, okay, and drift and shift also, and role of laboratory diagnosis in influenza virus. So it's a big question, and of course, influenza is commonly expected question. So when you talk about a myxovirus, we have two. When you talk about myxovirus, we have two. We classify them as orthomyxovirus, orthomyxovirus, and other one is your Paromo, paromyxovirus. Paromyxovirus. Okay. These are the two things, orthomyxo and paromyxovirus. Okay, paromyxovirus. So now, how to remember? So when you talk about orthomyxovirus, only thing is that the main difference here is, when you talk about main difference, it is segmented. It has a segmented RNA, segmented RNA. These, they don't have non-segmented RNA viruses. If you remember RNA viruses, I told to remember Bora, right? B-O-R-A. Bora, if you remember, B for when you talk about the segmented viruses, we had this shortcut to remember as a Bora. In that, O was the orthomyxovirus, if you remember. Okay, Bunia, Bora, Arena, and this is a Rio virus. They are the segmented viruses. Okay, that's what segmented, non-segmented. Okay, fine. So now in orthomyxoviruses, the classic example is your influenza. I told to remember ortho guys are having influenza. So influenza virus will come in orthomyxo. Paromyxo, how do you remember? Okay, paromyxo. First of all, everything is here. CPA. So you're going to write para-influenza virus. First is the para-influenza virus. R for not rubella, but you're going to write respiratory syncytial virus. Okay, respiratory syncytial virus. Then M. We have a lot of M. M for measles. Other one is your mumps. And there's something called metapneumovirus. Not that important. Okay, metapneumovirus, not that important. Another two important is Nipah, nowadays popular Nipah and Hendra viruses. Nipah, especially from the fruit bat, it is causing a lot of infections, you know. So now if we talk a little bit about the disease, though we're going to talk in further classes. So remember, parainfluenza virus cause acute laryngeo tracheo bronchitis, right? This whole combination we call croup also. We call it as also croup. Group we call it, right? Group. So this is steeple sign and all that we'll read in individual topic. This RSV causes acute bronchiolitis. It causes bronchiolitis. Measles, you know what it causes, a special rash all over the body, and then complication encephalitis and many things. It has mumps cause parotitis, you know, parotitis. Metapneumovirus respiratory symptom, not going to mention too much. Nipah and Hendra, it's individual. Nowadays, very, very popular. Okay. So these are the you have to know. Okay, but everything is there. Very simple to remember. Okay, now. What is the next question? Now everything is about the influenza viruses. So when you talk about influenza virus, first of all, little bit about the structure. So we already said few points already we told that this is a segmented RNA virus, a segmented RNA orthomyxovirus, segmented RNA orthomyxovirus. First point. Now, how does it look? So what we have actually influenza. We have influenza A, B, and C popular. D also, but this is more popular. A and B are usually having 8 segments. 8 segments, where C has only 7 segments. Okay. So few examples. Okay, just to remember. So 8 segments, 7 segment. Now, when you going to draw the picture of this, it's very simple. You always, for influencer, you have to draw the picture. So usually there will be an outer envelope, right? There will be an outer envelope. You're going to write this envelope. And then you're going to write this 2 types of the picture is given, so don't worry. So there will be like this. Okay, all this. So there are 2 types of things. One is your hemagglutinin, HA, and then in between the hemagglutinin we have neuraminidase. Okay, HA and NA, and also there is something called matrix protein, M1 and M2 matrix protein. They are matrix protein, matrix protein. And of course, with an icosahedral symmetry, that is basically the nucleocapsid. Like everywhere you have, not much difference. You are going to see what? Something, you're going to the segment. How many segment? 8 segment. 1, 2, 3, 4, 5, 6, 7, 8. So there will be 8 segment of your RNA. This is important. This much is the picture. Very, very simple. The picture I have written, you can see now. This was shortly I mentioned this. Okay. Now, so now a little bit about neuraminidase and the hemagglutinin. So difference is hemagglutinin one place, and on the other hand we have neuraminidase. So if you're going to classify this, it's very important. You have to know this. One more question. So also you'll usually have question from this point. Okay, from this two. So basically, hemagglutinin, it just helps in the binding. It binds to sialic acid receptor here. And what entry? So it helps in the entry into host cell. It helps to enter. Okay. Whereas neuraminidase, what happened? It destroys this receptor. It destroys this sialic acid receptor. That's what this is also called as sialic acid. They call it as neuraminidase as sialic acid also. Sialidase. They call it as sialidase. Sorry, sialidase because they break the receptor. So this helps in the it helps the virus to get out of the host cell. Okay, so it helps in the virus to get out. One is to entry, one is to exit, get out of host cell. Okay, that is what there's a process called elution. Elution means reversal of hemagglutination. So hemagglutination is caused by hemagglutinin. So elution is caused by your neuraminidase. Okay, that's called elution. That point you should mention. The examiners will be very happy. Okay, so we are still in this structure, morphology and pathogenesis. Okay, so this is the main thing. Okay, now next point. Now, what about the antigenic variant? Very, very important. See, these structures we told and all. Now, we have two important things you call antigenic drift and shift. You can have separate question also for short question, or you will have one more question. Anything related you will have. Antigenic drift and shift is very, very important. So how to differentiate this? Very, very easy. How to differentiate? First of all, antigenic drift is due to point mutation. But shift is usually due to genetic reassortment. Genetic reassortment of the genes. Yeah, that means genes get here point mutation in the gene. Here it is genetic reassortment. So point mutation. So the antigenic diversity. So the antigenic changes. Antigenic changes or diversities are less. Here more antigenic variation. So there is not much here. More antigenic variation. So because of more antigenic variation, it will lead to more large epidemics and pandemics. You will see a lot of epidemics and pandemics. But this is less. So you will have a very less epidemics. You will see less epidemics. Okay. Now, this is antigenic drift is common, usually seen in both influenza A and B. You can see. But shift is seen only in influenza A. Okay, that's it. These are the few changes. Okay, these are genetic reassortment, point mutation A. This, if you mention, more than enough. Okay, so this is the reason what's an antigenic drift and shift, which happens only in the influenza virus. You don't see it anywhere else. Okay, that's all. Next point. The next point is. Now, the next point is your the lab diagnosis. When you talk about the lab diagnosis, you should remember that the The best swab is nasopharyngeal swab. Nasopharyngeal, you remember when we have COVID also, same thing we did, nasopharyngeal swab and do a PCR. That's the best way. Okay. Otherwise, you can do egg inoculation. Egg inoculation, if you remember egg inoculation, the part which we used, if you remember, we were using the amniotic cavity. We were using amniotic cavity to grow it. Okay. For vaccine, we used allantoic cavity, but for egg inoculation, used amniotic cavity to grow. Otherwise, you can use the cell line culture. You can use different cell line culture also. And otherwise, of course, for like everything we can do ELISA. We have not that specific ELISA we have. And also we can use direct fluorescent also. Direct fluorescent, and you can check for this thing. That's it. These are the diagnostic role to diagnose the influenza virus. Very, very simple. Okay, if you write this, is more than sufficient. Okay. Yeah. Now, next. Now, myxovirus, if you see, they're divided into two families. Or so same thing. This is the same thing only referred to. You see everything is mentioned, so you can go through it once. Okay. Pictures, everything is given. Okay. Now, what the varicella zoster here? Now we are in the varicella zoster. So, etiology, pathogenesis, and the clinical features and prevention herpes zoster virus. Okay, herpes zoster virus. So, first of all, herpes, we call herpes zoster virus or varicella zoster VZV we call. Okay, fine. So, they are also, you know, it comes under herpes group. So, we already told it comes under human herpes virus 3. Okay, so usually it causes two diseases. One is the chicken pox. It causes chicken pox, and other one is in adults, it causes the shingles. In shingles in the adults, right? Children, it's chickenpox, adult, it is shingles. Okay, this one. Now, what happened? Usually the incubation period, it varies from 12 to 19 days. Longer, basically, it's a bit longer than other viruses. Okay. Now, so what about the chickenpox? When you talk about just the chickenpox, generally when you talk about this also, chickenpox, the two important things, the rashes are very, very important here. You should mention, you will have a again, vesicular rash, starts with vesicular rash, usually centripetal. Centripetal means it starts in the face and trunk and then goes to the arms. Okay, goes to periphery or arms. Okay, that's what it is, centripetal. Another one is this, these rashes are, you call it as pleomorphic. Pleomorphic means the different type of rashes at same time. The pleomorphic rash means same time you can have a pustule, we can have a papule, macule, everything's a crest, everything will be there, vesicle, everything will be, so pleomorphic rash, this is very, very important one. Okay, and they're usually bilateral. Whole body in bilateral side, you can see, not just single side. Okay, this is for the chickenpox. So the infective period is this important is infective period. The infective period is basically, it's basically 2 days before the rash and 5 days after the rash. They are infective till this whole period, 2 days before and 5 days after the rash. That's the infective period. Okay, yes. Now what else? Complication. One more thing is complication. Chickenpox complication usually leads to important skin infection. Of course, a lot of skin infection. And also, it can lead to different type of pneumonias. Okay, pneumonias. Even influenza also can do same thing. Here also, it can cause skin infection. Pneumonias can occur. Okay, that's it. Now, important is what happened when this varicella infection happens in the pregnancy. Pregnancy varicella is in a separate question also. That's what I told. It's always important. Gynae, everywhere it's important. Varicella, herpes zoster, we call it pregnancy varicella. Pregnancy varicella, if the infections happen more than 5 days before delivery, if the infection happened more than 5 days before delivery, or less than 5 days before delivery and 2 days after delivery, 2 days after delivery, then what to do? If it's more than 5 days, no problem. Protection. There is protection to babies. There's protection to baby. Nothing to do. But if it is less than 5 days before and 2 days after, then definitely chances are there. So you have to give immunoglobulin to the child. We have to give the child born. You have to give immunoglobulin. Okay. Yes. Now, what happened? If for these ladies, if they've acquired during pregnancy, if they've acquired during pregnancy if they've acquired. So what's the treatment you're going to give? No vaccine, because vaccine is a live vaccine. So you ought to always give only what? IV immunoglobulin plus acyclovir. Acyclovir, no vaccine, okay? Immunoglobulin and acyclovir, that much only. Okay, fine. Now, what happens if the child has this is so this one. So when before less than 5 days, 2 days, that child will have what? Neonatal varicella. For that neonatal varicella only, you will be giving immunoglobulin to the child. Okay, fine. Now there is something called congenital varicella. Congenital varicella. In congenital varicella, in the early pregnancy, if the child acquires the symptom, so what will happen? Then that case, the child will have something important called limb hypoplasia. Limb hypoplasia, I'll show you the picture. The limb will not grow properly, and also microcephaly. The child can have microcephaly. And one more thing also, they can have cicatricial skin lesion. There will be scar in the skin lesion. So these are the important things you will see. These are the symptoms. Okay, fine. Now next. Now the other one is called what? Shingles. Shingles in the adults. In shingles, it's a bit different. Why? Because in shingles, what you see is that you basically see in shingles unilateral. One side lesion, vesicular lesion along the dermatomes. Because we told that this virus remains dormant, latent in the neurons. So unilateral lesions dermatome along the nerves. Okay, basically along the nerves. Dermatomes means along the nerves. It's very painful lesion. So what you do as a complication, usually it causes what? Post-herpetic neuralgia. See many of them, they have post-herpetic neuralgia, especially immunocompromised will be very severe in AIDS patient and all. So here for this treatment, you know that we give gabapentin or pregabalin. Okay, these are the two important treatment we are giving in this post-herpetic neuralgia. Okay, these are the common when you have shingles, patient will, and if it is affecting the eye, you can have zoster ophthalmicus. Zoster ophthalmicus. Eye will be, they get blind if it affects the eye. I know they can get blind. Okay, zoster ophthalmicus. And one more also, Ramsay-Hunt syndrome. Ramsay-Hunt, when it affects your geniculate ganglion, Ramsay-Hunt syndrome, the patient have facial paralysis. They can have facial paralysis. This much only. Okay, Ramsay facial paralysis. These are the complications. And then, of course, the prevention. So here see, again, diagnostic part, I'm going to write very shortly. Same thing what you do. You will be seeing for a Sangsmere multinucleated giant cell. And of course you can check for Sangsmere, same. You can do a PCR, you can do ELISA, same like that. And you can do cell line culture also, not much preferred, but you can do. Okay, so these are the things you're going to do. Treatment is again acyclovir. But they told prevention. For prevention, as I already told you, for pregnancy and immunoglobulin only and acyclovir can be given. Ideally here, the vaccine, if you see, the vaccine name is simply, it's a live vaccine. It's live, so you should be careful. So the vaccine strain name is OKA strain. So when you have chicken, you say okay, right? Okay. So these are the things common for the shingles. You should know. Okay, very, very simple. So explanation is given very clearly, so you can follow it. Okay. Yes, so everything explained here, you can see very nicely. Shingles, etc. Sangsmere. Now, what's the Sangsmere? Sangsmere is basically, it's very simple, not that difficult and all. Yeah, what you do is, in Sangsmere, basically, usually seen in what? You do it in herpes simplex virus or varicella zoster virus. Basically, there will be vesicles. There will be vesicles. There will be vesicles. So what you have to do whenever there is this vesicle, so in Sangsmere, you choose the fresh vesicle. You choose the fresh vesicle, and from the base of that vesicle, base of the lesion, you scrap it. You scrap the lesion, okay? You scrap the lesion, you scrap and take it out. And after scrapping the lesion, what you have to do is that you have to make a smear. Scrap that and make a smear. And then stain with what? You stain with the Leishman or Giemsa stain. Leishman or Giemsa. And then what? Then you will be looking, when you look under microscope, you will be looking a multinucleated giant cell. multinucleated giant cell. So that could be anyone. It could be herpes or it could be varicella zoster. That means basically you have to, when you take a fresh vesicle, clean it first. Clean the region, clean the lesion, and then from the base of the lesion, you scrap with a blade. With a blade, with a sterile blade, you scrap the lesion, make a smear, GIMSA, then send it. Multinuclear giant cell. Very, very simple. Okay. So this is very important. Sang smear and next. Everything is mentioned. You can see multinuclear giant cell pictures given here. Okay. MMR vaccine. MMR vaccine, very simple vaccine. You guys already must have studied a lot in this thing. I'll explain. MMR basically, it's the measles, mumps, rubella vaccine. Okay. So each one has its own strain. For measles, you're going to use Schwartz and Edmonston strain. Edmonston, Jagrib. These all are important for 1 mark question. Jagrib. Okay, Jagrib strain. For mumps, that is your Geril Lin strain. And for rubella, it is RA27-3 strain. Okay, these are the strains you're using to make this vaccine. First point. Second point, they all are what vaccine? It's a live vaccine, excuse me. It's a live attenuated vaccine. It's a live attenuated vaccine. Basically, it's a live vaccine. Okay, so you'll be careful. So a few doses is enough. So what is a few doses? So usually you give it this is very unstable vaccine, so you keep it -20°C mandatory. Okay, and then how do you reconstitute? Use distilled water for reconstitution. Distilled water, you use the distilled water for reconstitution. Okay, you use the distilled water for the reconstitution. You will do this. Okay, then next one. So next what is the route? The route of administration should be subcutaneous, not intramuscular, subcutaneous. Okay, what is the time when we have to give? And according to national immunization schedule, you are going to give the vaccine at 9th month after childbirth, 9th month, and later your booster at around 2 when the child is at 2 years old. Okay, 9 months, don't forget, 9 months is very, very important. Okay, so live attenuated, everything we mentioned. Now, what are the contraindications? When you talk about the contraindications, you shouldn't give this vaccine to whom? Because it is live vaccine. First of all, if the person is already having MMR allergy, and also to the patient, immunocompromised patient. Immunocompromised because it's live, it can cause the disease itself. So immunocompromised patients, you don't give for them. Okay, don't give for MMR allergy patient and also immunocompromised patients. For these patients, it's totally contraindicated. This much for the short notes, if they're going to ask you, you can easily write it and score very well. Okay, so definitely I'm sure it will be repeated in PSM also, but now only you can remember MMR 9 months you're going to give. Okay, the rest all subcutaneous, live attenuated, distilled water for reconstitution. So easy. Okay, yeah. Now next question would be, everything is mentioned. You can go through this. Yeah. Now, difference between influenza and para-influenza. We're almost coming to the end now. So what is these things? We're just going to see here. So we have difference between influenza and para-influenza. We already studied influenza virus, a little bit twisted way they asked. Influenza is something different. Para-influenza is different, right? Though it sounds similar, but both are different. So how to differentiate it? Influenza virus and para-influenza virus. Now, influenza virus. When you talk about influenza virus, just we spoke about it. This belongs to it orthomyxovirus group. Orthomyxovirus group. Okay, orthomyxovirus group. Para-influenza belongs to paramomyxovirus. Paramomyxoviridae or virus group. Okay, same, the group, the family. Okay, so orthomyxo group means they are always segmented. So I told ortho guys have 6 packs. They are segmented. They have flu also. Para-influenza, non-segmented, though both are RNA viruses only. Okay, they are non-segmented RNA viruses. Non-segmented RNA viruses. Okay, first point. This is the first point. Okay, next. When we talk about your influenza virus, we were frequently talking about what? Genetic ressortment. Genetic ressortment, right? So it's here. Here, no, we don't have any genetic ressortment. Because of genetic, the antigenic variations are very high. high. Here, no. Again, no. Okay. Yes. Now, next point. Next point, RNA synthesis. When you talk about the RNA synthesis, it happens in the host nucleus. Influenza always in the nucleus. Para-influenza, it happens in the cytoplasm. Cytoplasm. Okay. RNA synthesis happens in the host nucleus. Here it happens in the cytoplasm. That's it. Nothing much. Okay. Fine. Now, what else? Yes. So this is one of the causes because genetic reset, right, causes major epidemics and pandemics. Pandemics here? No, not that much. It doesn't cause much epidemics and pandemics and all. Okay, so these are some basic differences. This is, if you write, this is more than enough. You know, if you're finding where RNA synthesis, major epidemics, etc., the examiners will definitely be happy with that. Okay, so that's all. This is about the differences between influenza and para-influenza. So that also we have explained it here. You can see. Everything is mentioned. Giant cell also. This thing we haven't mentioned. This the surface protein and other thing. Excuse me. Sorry. 1 second. So genetic resortment and the rate of any changes is mentioned here. Another one we didn't say, but that's okay. The same. Okay. Yes. These things. So we already saw one. Yeah, size is smaller. Here it's bigger. The few things is the surface spikes are HNN different. Here it is same. That is one thing. Giant cell is fine. It's absent, and here it's present because measles we have giant cell, if you remember. Okay. So these are the few things here. There. So these are the things that you know you should keep in mind. The rest all things, if you have any doubt, it's given here. You can go through it. Okay. So thank you once again for watching and being Auricles. Once again, you can go through, see what is best for you, choose the right thing, and all the best once again. That's all. Good evening.